AWEP is Advanced Wilderness and Expedition Provider, and it was born out of this need to provide at these conferences on wilderness medicine focused approach to patients in the field. You can learn lots about lightning at these conferences and altitude and hypothermia and animal bites, but AWEP teaches folks how to approach usually an injured patient in the field. One of the things that's really exciting about AWEP is that our students come from such varied backgrounds. There'll be Army medics sitting next to trauma surgeons, next to a nurse practitioner that does wound care, and suddenly there's 35 students that provide so much additional input into the course. And I think that's part of what makes us so excited about AWEP, is that there's this tremendous amount of knowledge and experience that comes into the course, and it always makes it exciting for us. I think the really great thing about running AWEP at this big national conference is that it combines this perfect balance of academic topics with a really field-oriented, hands-on, common problem-solving approach to field wilderness medicine. The way that we try to teach AWEP is that it will appeal to all levels. We assume everybody in there already understands the basics of emergency medicine and how to approach patients. So we jump right into a field-oriented approach. How do you deal with patients following wilderness medicine emergencies? An avalanche, a rock fall, a bad ride through a class 5 or 6 rapid. What do you do? There's the patient, they're on the bank of the river, they're bleeding and or unconscious. You show up, how do you organize the rescue? What do you do? How do you try to fix them? And how do you get them out of there? I'm Howard Donner. I'm a physician and have spent my entire career working in and around wilderness medicine, including search and rescue, research, and expedition medicine. And now here I am teaching medicine at this national conference, which is something I really enjoy doing.